been a second. Yeah, it's really great. Thanks for taking the time. Kizito. Hey, we lost the man.
Friends, I hope this is better.
I liked the other background, I have to admit. I got like twice as much Kizito as I was expecting. So I was pretty excited.
Yeah, the other one was very colorful. Beautiful.
There we go.
Hey, it's nice. Also, you float. So I don't know what shirt you're wearing, but it blends directly into the background. So this sort of omniscient head is floating around.
That's nice, you know.
Yeah, I mean, it's something.
I really didn't, you know, think through, but hey, I'm liking it too, you know.
Yeah, I think you do well.
Makes me look invincible.
Maybe I can, Caitlin Home,
Yeah.
hi, are you able to rename yourself? I'm gonna ask people to rename themselves so that we can sort of run through introductions pretty quickly. We'll try to do it just with the group that's on now, but as people trickle in.
Yeah, what would you like me to rename myself to?
Just your affiliation.
Gotcha.
I mean, keep your name, obviously, but then
Kind of like that.
I think that looks great. So we may ask everyone to, hi all, thanks for joining us. If you wouldn't mind to either rename yourself or if you can join us on the shared document. I see a lot of you in there already. And if you want to put your name, any information about yourself, if you want to share your contact information, and then we can be sure to connect with you afterwards and follow up with any of the others who've joined or who might have a question. We're just letting a few of our panelists connect. You see Prince and Kizito are on. Winnie, how is your audio?
Yeah, my video.
No worries on the video. I'll share a picture of your face. Everyone can see.
Please do, thank you. That's the best I can come up with.
Yeah.
Getting light.
So Kizito has two of them and you have a picture of the internet, or maybe you are just embodying the...
Hey, Mary. Hey, Kizito. Hi, Prince.
Hi, Winnie.
Hello.
Okay, so we have a lot of friends on the call. Many of you know each other. I'm just going to this time do a quick introduction of the event and the call. And I'm asking everyone who has a chance to either rename themselves with your affiliation or even better, join us on the Google Doc and add your contact or your information there so that people can follow up or that we can reach out with any questions for you. So my name is Kat Townsend. I'm a co-founder of Open Data Collaboratives, and we run this monthly webinar and speaker series to try to connect and form partnerships and collaborations and hopefully share some learnings from different people who are doing really good work on how to use data to advance progress around the world for sure, and definitely across Africa. So I feel very privileged to be able to welcome you all here. And I wish I had a moment to say hello to everyone, but I want to leave a lot of room for this panel discussions. And we also have some really interesting announcements at the close. So we'll take, I think, about 25 minutes, maybe 30 for this discussion, have 10 to 15 for questions. We'll leave about 10 to 15 minutes open at the end for some announcements. So I'm going to turn it over to our panelist and our esteemed moderator, Winnie Kamau.
Thank you, everyone. And I'm sorry my video is still misbehaving years later. So welcome very much. And in Swahili, we say karibuni sana sana. You're welcome to this presentation, this meeting. It's as my colleague Kat has already mentioned, that it's a monthly meetup. And today we are honored to have on our panel West and East of Africa. So on the panel we have Prince Appiah from Ghana. He's a data journalist. He's very renowned and has received several accolades for his good work. We have Kizito Cudjoe, also from Ghana. He's also a renowned journalist and also has received accolades for his very good work. And then from the East, we have Mary Mwenda, my colleague, and also a renowned journalist. And she's also received many accolades also for her work. So we are honored to be in the midst of well-trained and awarded journalists. And today, okay, the format of this discussion, because we have limited time, and I'll try and time myself, because I know like it's like 15 minutes. We will be discussing from the point of view, like sharing about the current, how is it reporting about COVID and with the pandemic, what is happening, and especially with the vaccines that have been given out. And I'll share a few facts for like 2 minutes, if you'll bear with me. So currently, we all know that 1.6% of Africa has been vaccinated, but the rest of the world is currently receiving their third or second dose, which is called a booster. In Africa again, 4 million doses arrived between July and now this month, and 245,000 had arrived, doses had arrived in Africa in June 2021. This is according to Africa CDC and WHO, and 80 million doses so far have been given out. And as I said earlier, 1.6% of the total population of 1.2 billion or 1.3 billion have been vaccinated, which results to 21 million Africans who have been vaccinated. And the COVAX facility says that they want to ship 520 million doses by 2021. And for 30% of Africa's 1.2 billion population to be vaccinated, we need 820 million. And according to Africa CDC, they target to have 60% of their population in Africa by the end of 2022 to be vaccinated. And they say they'll need 1.6 billion doses of vaccine. That is the 2-dose vaccines. So those are very huge numbers and too much numbers to look at. But in reality, we see that businesses have been affected by the current the current pandemic. And Prince, you as a business reporter and editor, what is your take about the global pandemic and even reporting about the pandemic?
Okay, thank you very much, Winnie. My name is Prince Appiah, as Winnie mentioned earlier. I'm the head of business desk with my media organization, Love FM, in Kumasi of Ghana. I would say that the pandemic has brought about a lot of changes and has impacted both positively and negatively on the newsroom in Africa. From our end here, it has compelled most of us reporters to become very critical about the information that we get before we put them out there. Previously, when you get to interview people or when you get information about a situation and you want to report on it, though you need to verify, which is very core of the journalistic work, you need to verify, cross-check and verify again before you put them out there. In this time, the pandemic have shown us that even though you continue verifying to check whether your facts are right or wrong, you could be swayed in a way because a lot of misinformation and fake news abound during this period. And so it has made our reportage as business journalists really difficult. And at the same time, has made us very critical with the kind of information that we want to put out there. So I think that this pandemic has really compelled us to be better of ourselves and ensure that every information, every data we are going to work with is really fine and the right information and well cross-checked before we put them out there, Winnie.
Okay, Kizito, what is your take down in, is it Kumasi or is it in Accra?
Yeah, sorry, Kumasi.
Yes, continue.
Yes, okay, thank you very much. I think you've already introduced me. My name is Kizito Cudjoe. I work with the Business and Financial Times newspaper, and I'm based in Kumasi. COVID-19, I mean, as has come to be known as the pandemic, has really affected almost everything that we know and almost everything that exists. Primarily, if I should relate it to what I do as a business journalist and the area I cover more or less, you'd realize that, I mean, clearly businesses are suffering. I mean, the impact of COVID-19 on businesses is quite unmeasurable. My last check with the Ghana Statistical Service, Ghana Statistical Service is in position to, provide some up-to-date data on, because of project, what is the term COVID-19 business tracker reporting. It's something they have as a project they are doing to give up-to-date information as to how COVID-19 is impacting businesses. I can't remember the last information that they provided. They said that they linked it to the partial lockdown that Ghana announced from March to April thereabouts, that the lockdown alone affected about 35.7% of businesses. I mean, and these are businesses that are mostly small in nature. Most of our businesses here in Ghana, you'd have about, on top of my head, about 75% of them being small in nature. And if you look at what happened with the pandemic and the fact that the government had to announce a bit of restrictions here and there in order that we could, ease the rate of infection. Business activities generally slowed down. And from a reporting point of view, if you looked at the kind of information that were coming from the business persons when you interact with them personally, sometimes on the phone, because we could not get, access to them at the time directly, as it used to exist, you could really feel the pain that they were feeling, because a lot of them had invested heavily in their businesses and had no prior knowledge that something of this nature was coming to happen. For those who probably even saw news of COVID-19 happening around in November, December, thereabout, in far away Asia, I'm sure many of them never anticipated that it was going to be hard hit on them. So, I mean, if we want to talk about the business climate and how COVID-19 has affected, business, and to the point where the businesses that we report on them and the sector that we report on, in Kumasi, most especially, businesses have slowed and businesses are now picking up. Unfortunately, as businesses are beginning to, pick up also, then comes what we are experiencing, what we term as the third wave of COVID-19 infection. This is what currently we are facing. And many people are fearing that we could possibly go on a lockdown if the numbers begin to rise. Our president, not too long ago, came out to update us on the latest infection, gave us the regional breakdown as to the number of persons that have been infected and some of the measures that have been put in place to keep the increasing infection. And this time around, the Delta variant has been one of the topical issues we've been discussing here. Not too long ago, our regional minister was in the news today, instructing that the police service have been put on alert to arrest anyone who is seen in public not wearing the nose mask. And so when these things happen, of course, it put almost everyone on the edge, and it affects a lot of people, except for those who sell nose masks, those who are in the business of selling nose masks, because
yes.
when the virus go down, or when the infection goes down, many people don't wear the nose mask. But when the numbers begin to rise, then people tend to get more nose masks, and then it becomes a business area for them. So I mean, in brief, this is what is happening here in around the business sector.
Very interesting that the businesses that are going up and down, especially going up, is a business of selling masks. While in other countries, especially the developing countries, they're thinking of how to get away or to get rid of masks because they've already vaccinated their people. Like 70–80% of their population are vaccinated, and they're also getting boosters. That is a very big contrast. Mary, talk to us. What is it that we can talk about in terms of vaccines and your experience? You have been vaccinated, have you?
Oh,
your
yeah.
experience even in getting that vaccine.
First of all, thank you for this opportunity. I would like to say COVID-19 came in Kenya as a shocker, because it has disrupted many sectors, including the media sector. So when vaccines were launched, there have been a lot of issues around vaccines, especially with the rising number of cases, and especially when this Delta variant came in place. So about vaccines and in terms of journalism and coverage, there has been a lot of fake news around vaccines. And this has been a challenge even to some of us when reporting, because as a health journalist, before I do any story around, maybe let's say somebody saying somebody has been injected with water as a vaccine, it's tricky for me to run such a story because I haven't verified whether that was water or it was a vaccine indeed, because I'll need somebody who is in maybe a government lab to verify whether it is water or it was the real vaccine. So there has been a lot of fake news going around. But that said, doctors have been really supporting vaccines. They are saying it is helping to not to prevent it, to somehow prevent, but also there are people who are taking COVID-19 with the vaccine while vaccinated. So also it's an area that our scientists are now looking into, doing more research to see why people who have been vaccinated have also started getting the disease. But all in all, they are saying a vaccine will help you not to get the severe type of COVID-19 or not to be admitted in the ICU. So for me, the vaccine area coverage as a journalist is very tricky, and it needs a lot of research and analysis and a lot of patience and a lot of verified data to be able to give out to the audiences a story that is credible, factual, and well researched. And I've seen that is not really happening in many of our stories which are running on a daily basis. I don't think it's because of lack of time, but I think it's because of even the researchers sometimes are not willing to give a lot of information around the vaccines because it is an area they are still doing on research. Personally, I tried accessing our research body called the KEMRI, the Kenya Medical Research Institute. I wanted to do a thorough interview around the vaccines, but I was taken into circles, and one of the scientists revealed to me the reason is they have not done conclusive research, and they do not have conclusive findings around the vaccines that are coming in to be able to give out information, because anyone who gives out this information, it might backfire on them. So that's what I can say about vaccines. So there's a lot to learn. It's a learning process for both us as the public, the journalists, and also the research team that is doing research on the vaccines. Yeah.
Thank you very much, Mary. You brought out a very good angle in terms of misinformation and in terms of verification. Because yes, indeed, talking to scientists, especially about vaccinations, and recently, last week and even today, I was just listening to Africa CDC, and the journalists were asking WHO Africa's WHO director and Africa CDC director about why are people who are vaccinated still falling sick and some of them dying. And every time you try, which is very unfortunate, and I'm so sorry for that, but according to them, they're saying it should help you from getting severe experiences, or rather for the virus to be more severe on you. But even them, they don't have like real legitimate answers to give to people. So they're also doing their own research, and they're trying to figure out what is happening. But Prince, in misinformation, what have you seen when you're reporting?
Yeah, Winnie, it has been very, very challenging, I should say, that misinformation is one of the biggest issues now when it comes to reporting in this particular period. Even before the vaccine started coming in, when the pandemic started, that was the challenge, because you get to hear information about people, especially in certain areas of the country, for instance, taking a certain particular local herbs that were believed to be cure for the COVID-19. We were also hearing information about people claiming that the disease or the COVID-19 proper was an evil doing. We're also hearing that it was employed by the Europeans to cut the population of Africans. And so all those things were jumbled up, and it was left onto us, the journalists, and we in the public space to decipher and get the right information to the people. And it was really, really very difficult, because For instance, with the local herbs that were being used, for instance, some of our parents and some of our families were using it long time and it was working for them, especially with some of the symptoms that came with COVID-19. And so you tend to believe that, oh yes, it can address some of the symptoms that came with COVID-19. But along the line, as journalists, and of course, we realized that they were just symptoms, but we needed vaccines to help address some of these things. And the information went out there, and as a result, it even affected the vaccines when it came in. Taking the vaccines was a challenge. A lot of people were not interested in taking the vaccines because of the information, the misinformation that had come earlier about cutting down our population, about affecting our sexual libidos, affecting our health in a certain way. And so people didn't want to take it, and they had to take a lot of public campaigns by chiefs, by the media, and at a point in time, myself, I contracted COVID-19, and after going through the recovery process, I had to document how I, going to the hospital, getting well, and all that, and had to share with some friends for them to understand that really the disease was real and it was affecting people, and that we had to take care of ourselves. And from that, realized that a lot of media personalities even had to come out publicly to put their status out there. All those were means to encourage people to now believe that indeed the disease was there. People had to take care of themselves and ensure that you go in for the vaccines to reduce the impact, the severity of the virus on the population. And so those kind of misinformation really impacted us. And we as reporters, we struggle to even get information from the people, because when you are doing a story and you wanted to speak to, say, a group of people who were not in the main land of Ghana, say Kumasi and Accra, and they were in the outskirts of the country, for instance, hinterland, for lack of a better word, they, for instance, did not care about what was happening.
Prince.
I think that Prince's line is bad. I'm sure he would join us back soon. But just to add briefly to what he was saying, so the issue of misinformation, I think at the early stages when we started recording, COVID-19 infections, the government tried to set up a platform where the public could easily access information. There were regular COVID-19 updates that were done from the president himself did that, as well as the minister in charge of health and the various health authorities regularly came to the media or organized forums to share constant updates on COVID-19 infections and what is being done to curtail the spread of the virus in the country. I remember they also announced a short code where the public could send a text or sometimes try to notify authorities if they experience the symptoms, the COVID-19 symptoms of the headache, and other symptoms that they talked about. That if you begin to experience any of these symptoms, reach out to this number just so that a team can quickly rush to your end to begin to process you and see if you could be tested for the virus and so on and so forth. So that was one of the things that they tried to do to provide a lot more information to the public. However, there were those who generally had their own thoughts about the outbreak of the virus. Like Prince said, I mean, people had weird thoughts that, this was the machination of some Europeans who wants to beat down the population on Africa. and for that matter, have invented this virus and they was spreading it to Africa. And of course, clearly, when they were making these arguments, they were suggesting also to the effect that definitely they are going to come back to introduce a drug to try to, say that use the drug to, save yourself from the medicine. And it is there that many people are also going to die. So these were some of the things that they began to put in the minds of people. So at the time vaccines started arriving in Africa and in Ghana, many people were, hesitated to take the vaccines. I mean, some of us clearly did not get the opportunity to take the vaccine because by the time we were ready to take the vaccine, I mean, we knew that the arrangement had changed and the centers had been moved to other places. But some people, because of the myth surrounding the COVID-19 virus, how it came about and, how it was being spread, and the fact that there were some pronouncements out there about how possibly, African infections and deaths could rise, people didn't want to take the vaccines, and it became a very difficult thing to do. But there were efforts from the media and the various media houses and some authorities to also, campaign for people to openly take the vaccines, because it was that the vaccines that you can take to, limit the severity if you should, get infected of the virus on you. So those were the things that were happening within the media space. In terms of journalists fighting disinformation or misinformation, for some of us, the best we could do was to try as much as possible to stick to up-to-date and accurate data to do our stories, whether it was related to business and COVID-19 or whether it was related to vaccines. Clearly, we had the authorities or the institution that we needed to go to for those information. So anytime you see anything which was contrary to an information that is purported to be coming from a particular institution, for those of us who have knowledge of accessing the various websites and media portals of these institutions, we quickly go back to the scenes and try to verify if the information have been uploaded online from these institutions that are being purported to have given this data or this information. However, when we don't find the information there also, what we do is that because around the time our numbers was rising, it was difficult to get information in real time, and so the best we could do was also to phone our sources directly and to confirm from them if indeed this information is coming from their outfit. And yes, we did get some good responses coming from them. Other times it was difficult getting through to some of these people, but by and large, we've lived with it and we've tried as much as possible to do good stories, to tell, I would want to say accurate stories to as a way fight the disinformation that we experience out there.
Thank you very much, Kizito, and thank you, Prince, for sharing with us. In terms of local hubs, we carried a story also on our portal, on our news site about local hubs and what they were doing. And it's true, there's been misinformation about that it's the vaccines are going to reduce the libidos of men. And currently, even I had the question that was asked last week still, I feel like it was yesterday, to the Africa CDC and to WHO, that some of the girls or the women who have been vaccinated, their menstrual cycle has really been changed completely. Like they have, some of them are bleeding excess, others, the cycle has really been tampered with, and they credit this to them getting the first dose of the vaccine, and others have gotten the second dose. And when Africa CDC and WHO were asked they scattered around the question and they said they would get back. So actually, this is a reality that we have to grapple with. Mary, do local hubs help, or this is still misinformation? And how do we deal so that we can get the real data in telling stories?
Okay. About local hubs, indeed, they are very helpful in disseminating information around COVID-19 and more to speak around vaccines. I must say that personally, I've really learned a lot from local hubs, because some even conduct specific trainings and meetings around COVID-19, and they would bring in experts. And some of these experts will have arrangements with them. So they'll give information on COVID-19, and this information they'll tell the organizers, any journalists is free to quote them. But again, beyond that forum in the hub, when you try to follow that scientist, maybe to verify something they have said around that, it becomes a bit tricky. It's normal for scientists and doctors to behave that way. And I think it's good for us journalists who are working around stories on COVID-19 and COVID-19 vaccines to push further, and also to use the Freedom of Information Access Act, especially in Kenya, because this will help us push some of these government entities to be able to give us information. For us in Kenya, even my colleagues here can tell, COVID-19 information is disseminated through the Ministry of Health only. And then through the ministry, it's only the Gavi, the people doing the vaccines, helping in the research vaccines, and then the KEMRI. Nobody else is allowed to give information. So at times, we are not even sure whether the information and the data they are giving is truly accurate, because there have been stories. I was in the Coast region, I think 2 weeks back, and I could hear people saying the ICUs and other hospitals are really full to capacity. But that was not reflecting in the government data that is being released every day. So I was wondering, okay, this is what I've found on the ground. People are telling me the ICUs and hospitals are full, but when the CS for Health is giving his daily speech on data about COVID-19, you find that they were not highlighting the Coast region as being a hotspot. It was being highlighted only as the Western and Nyanza, where the Delta variant is very common now. So that has been a challenge, because even if the government is giving this data, we are not so sure how accurate it is, because they're the only ones giving, and they are not willing anybody to question them a lot of questions, because when they give that information, they are usually in a hurry. At times they give time allowance for questions. So you find journalists are asking very quick questions, and then they just leave. Then based on that, stories are generated. Therefore, any further story to question and interrogate further becomes a bit difficult. So for me, what I can say, we need to push for the Freedom of Information Act to be fully implemented, especially here in Kenya, because COVID is with us. We will still have cases of COVID in the near future. And without pushing for this Freedom of Information Act to these government entities to be able to give us credible data, and even to question the kind of data they are giving us, it is still tricky for journalists to be able to tell credible, analytical, and well-researched stories around COVID-19. So for me, even as the journalism sector, we need to start interrogating some of these laws around access to data, to bring in the angle of COVID, saying that COVID is here, but we are getting data that is not, we can't even verify, because we do not know. Like today, we can be told 800 people have COVID-19 in Nairobi, you see, but how do you verify? How true is that data? You see, as a journalist, you don't just believe anything being said, but we need avenues where we have to interrogate and verify this data for the good of the people that are our audiences and for the good for the public. So for me, I feel that is still a letdown from the government side, as much as they have issues to protect, but I believe we need a clear and a structured way of giving that information so that even journalists are able to access raw data. You know, even when they say 10 patients have died of COVID, do you know you can't go and verify with the hospital, maybe from the doctor's reports, indicating this patient died of COVID. Nobody is allowed to do that kind of verification. And I believe as journalists, we need that kind of verification to trust those numbers. And right now, that is a gray area. We do not know. Even if we are told in Nairobi 10 people died today, I'm not able to go to a hospital and get to the doctor who was in charge of these patients and show me physically the document saying these patients died of COVID-19. Thank you.
Very true, by the way. There's no, in Kenya, actually, it's really blunt because there's no verification. You just given the numbers and you run with it. You don't have room to question what and where and what happened. But I'll quickly go to the questions that are on the chat. And thanks a lot, Mary, for bringing out that, and especially Access to Information Act, and how best we can be able to activate it for our benefit. Not only, I know the Access to Information Act, I guess it's working also, or it's there even in Ghana and in many other countries. How best can journalists get in and come in and work with it? And I see Wisdom, when I mentioned the numbers of the vaccines, and Wisdom said corruption is what I see. COVID-19 has revealed who we really are, both negatively and positively. Then Florence laughs, and then we see Simon says he's joining from Ghana. And then we have somebody, Aki from Cambodia. Welcome, Karibu Sana. Then Simon says he's a public health student. I mean, Aki says he's a public health student. Wisdom is asking again, what about men? Has anything changed? Any man who's been vaccinated, you can tell us your experience. Has anything changed since the vaccination? Because we've talked about women talking about their menstrual cycle. Yema, thank you, Mama, for joining us. Beyond the hub, and we're talking about the hubs. How do you promote media information literacy for the general public to be able to identify misinformation and disinformation? And I believe there's a very good program and project that Yama is doing all the way in Sierra Leone. And then we have government issues daily data. How do you build trust in the stats disseminated by the government? And oh yes, anyone else who there's a fine balance, Yama says there's a fine balance, ethics and public health reporting. How do you minimize harm in reporting on public health issues? Yes, Yama, can you be able to talk to us about how has it worked with you, especially just for a few minutes? Tell us, and if anyone, then we can open up to questions. If anyone has, you can just raise your hand. Because Yama is currently, she's heading the information being presented by the government of Sierra Leone to the journalists, and heading Sierra Leone news agency. So hence we're talking about that. And Michael Faraday, do you have a question?
Winnie,
yes, please.
Before they come in, there were some two quick things I wanted to respond briefly to. One was by Mary's comment about verifying the data being provided by the government. I think that we need to establish a certain understanding that these individuals who contract COVID-19 and die should be, they have right to privacy. And sometimes it is not good getting data or information that says this person died directly from COVID-19. You do so because you don't have to do so, because sometimes, when you report directly that this person died from COVID-19, the public tend to stereotype the families of the deceased member. You realize that in some instances, people don't want to get closer to them. There was a situation like that in Ghana where somebody was believed to have contracted the disease, and it was made public. I don't recall the exact issue, but I remember there was a TV interview that followed up later to say that people within the community started shunning the families of this person who had contracted the disease. Yes, we may be talking about means of verifying the information that government is putting out, but to explicitly state that this person contracted COVID-19 and died, and know that might be a bit of a worry.
Yeah.
So we need to find a fine balance to work. And then on the issue of misinformation
Yes.
in media literacy, I know personally that Dubawa, an organization, a fact-checking organization in Nigeria, has reached out or tried as much as possible to set up footprints across most West African states, and is helping a lot in terms of putting out fact checks on some of the information that pops up on the social media, more especially about some of these disinformation about and misinformation about COVID-19 and other things that could be done to, curb yourself of the virus.
Thanks a lot, Kizito, for that response. And when we're talking about verifying data from the government in terms of even going to a hospital and confirming from them, we're talking about anonymized data. Like, you're not getting the exact name of that person, but you're just getting the numbers just to verify indeed if it's true. But we also need alternative sources. We see. Sorry,
Winnie,
Kat?
Sorry, Winnie, I'm just going to, because we have 10 minutes to go, I'm going to have to thank everybody for the discussion. And I know that this has been dictating our lives for a year and a half, and it will continue to do so. And there's no way to have a rich enough discussion that covers all of these issues and all of these topics. So I really want to thank everybody for everything that you've been able to say. I know there's a lot more to say. Thank you to Mary specifically for the policy, so it feels that there is something that can be done, that this is an action that can be taken. And I just wanted to point out one, because it's been raised now twice, about women's health. And I shared a link in the chat that women's responses to any disruption in their immune response will affect your menstrual cycle. And so it's also, I just have an open question of the responsibility of reporters, if you ask a question, to then follow up and say, what is the reasoning behind, these reports that we're getting? Because it can be very scary to hear these reports and then not have a follow-up. So, so I think it's pretty vital to figure out how do you, as Yema has asked, how do we get the data literacy in the community? How do these stories get shared from journalists, and how can we hear more from you all in how to have a better COVID response? So Yema has asked a question. So I know that she also has an announcement. So I wonder if I can thank you all for the discussion and ask Yema to maybe close us out if you're still on the line, and share with us your, she may have needed to drop off. No, Yema, can you hear us? Are you able to access your mic? Okay. Yema has asked a few questions, and as a journalist in Sierra Leone, I was hoping that she could maybe ask her question.
Kat, she's in a noisy place, so I don't think she's going to be able to unmute right now.
Okay. Jean, would you like to speak to Yema's announcement, or Winnie, I realized that I closed on your ending if you wanted to close us out and turn us over to announcements.
Okay, cool. Thanks, Kat, for that. I know it's interesting when you're talking about interesting things, time runs so fast. So thanks a lot, the panelists for your time. Thank you, Kizito. Thank you, Prince. Thank you, Mary, for your amazing information. And we look forward to hosting more talk shows, or rather just brainstorming on how best you can be able to tell stories using data.
Okay. Thank you all. Go well, stay safe, stay healthy, take care of each other.
And thank you for joining. Asante sana.
Thank you all.
Thank you.
Bye.
Thanks, Kizito. Thanks, Prince. Thanks, Mary.